So I'm here with Senior Assistant Secretary, Mrs. Harry, and she's just going to tell me how she has found the Human Resources for Health workshop so far.
Well, thank you very much, Nika. It's a pleasure truly to be here at the Blue Lagoon Conference Center, and over the past 2 days, we have had some very interesting discussions as it relates to the HRA policy. Now, I think from a personal perspective and for health, that it really is a critical initiative that we have embarked upon. We have two consultants that have been here for the last 2 days. And the participants, I can attest to the fact that they have been able to contribute to the discussions as it relates to formalizing a policy to take the Ministry of Health forward.
So we're here with Dr. Gittens, and she's going to just give us her perspective on the last 2 days of this HRH workshop.
Well, it is said that the human resource is the most important resource in an organization, in an institution. As a matter of fact, not that it has been said, it has been proven that the human resource is the most important resource, because nothing happens unless we are operating in a strictly automated system. Nothing happens, nothing will move. The wheels of productivity will be grounded to a halt if we do not have the human resource. So what this workshop seeks to do is to look at where we are in the Ministry of Health, in this health sector, as it relates to human resource, where we are and where we need to get, and analyze the gaps in between where we are and what we want to achieve. The discussion mainly, we are brainstorming, and the thoughts. It is amazing what people can do when several minds come together, because things which an individual may not consider, somebody else will. And the group brainstorming session has been a phenomenal experience, and this Human Resource for Health workforce plan, I know that when it is concluded and implemented, because it must be implemented, that the Ministry of Health will be, and the people of St. Vincent and the Grenadines, because this is not just a plan for the Ministry of Health, it is for the overall improvement of the quality of the service which we deliver, and also it takes into consideration the impact of work on the person, on the staff member. So generally, the population of St. Vincent and the Grenadines and the health human workforce will benefit tremendously from this experience these past 2 days.
All right, here with Dr. Gail Tomlin Murphy, and she's going to pretty much tell us how the workshop has been so far. Welcome to St. Vincent and the Grenadines.
Thank you. Thank you. Thank you very much. And the workshop has been fantastic, to be in a place where there's a commitment to do things differently, and to really, really try to address the health needs of people living in St. Vincent and the Grenadines has been a very positive experience. Having an opportunity to work with the stakeholders, the very people actually who are involved in the health delivery system, and those people who are working in mental health, they're working in hospitals, they're working in communities with seniors and with young people. Maternal child health has been very, very rewarding. For me, it's been impressive to see not only is it important to the country and to the Ministry of Health and other ministries, but it's also incredibly important to the people who are involved in the delivery of care, and also those who are involved in the planning of the health. So it's been just an excellent, excellent experience for me.
And what has been the response of the participants?
For me, I see we had the first day where we met with the government people, as well as government and other departments like education and public service and things. I've had the opportunity also to go to the hospitals and the health clinics, and people are enthusiastic. People want to be part of this change. They see their responsibility being part of this, and they see it as being a very good time for this to happen.
You're very experienced in this area. Based on where we are now and where we need to go in terms of improving the delivery of improved health services here, what would you rate us, and how much work do you think needs to be done in order for us to get to where we need to be?
Right. I think the first part of the question really is critical, and that is there willingness to make change and do things differently? What my sense is, doing this in many, many countries, is I have a sense here that St. Vincent and the Grenadines is committed to doing it differently. There seems to be ideas, there seems to be realistic ideas in terms of the resources that would be required to do this and to do things differently. And my sense is that it's very, very achievable. I will be here working for over a 6-month period, and will have the privilege of coming here about now and a couple of more times. The extent to which senior people, as well as people involved in care delivery, are involved in this project, tells me and makes me feel very optimistic, as opposed to it being a project that somebody wants to implement or to make the change without necessarily having the people who are involved in the delivery of care and the community themselves being involved. We're in a really good position. I'm feeling very optimistic about this.
I know that people tend to be resistant to change.
Mm-hmm.
So what encouragement could you give to Vincentians who may be seeing the changes apply over time in the health system? What advice would you give to Vincentians in terms of their approach or their attitude towards healthcare providers?
Right. I think that what the most important thing is going to be is that for people to realize that change is a good thing, and change only means that we are coming up with plans that will improve the way that health is being delivered. I think oftentimes we've learned to be pessimistic that things don't seem to be working, because some of the changes that need to happen in healthcare delivery aren't huge. It's not necessarily more machines or more equipment. It's actually having a workforce who is ready and able and supported to work with people where they are.